or if you did put it in, just at the end, let me know so I can go look for it. All right, so welcome everyone to our fifth session in this series on managing type 2 diabetes. Today we'll explore the vital role that all these lifestyle things have to do with diabetes management. We'll talk about nutrition, we'll talk about exercise, we'll talk about the gut microbiome, and at the end, we'll talk a little bit about how toxins in our environment affect us. All right, and hopefully we'll give you some practical strategies to improve your health. I think they're very vital, but some people may not, but I think they're vital strategies. We can certainly help you more if you end up joining our X Health and Wellness. So, but we'll talk about that at the end. So let me introduce myself. My name is Alexandra Santa Maria. I am the founder of RX Health and Wellness. And we are all about empowering women over 40 with chronic diseases to become healthier, chronic diseases such as type 2 diabetes. We focus on disease states that have underlying chronic inflammation, insulin resistance, gut dysbiosis, and toxic load, high toxic load. So before we start, just want to tell you a little bit about, in order to gain the most out of this presentation is to participate in answering any questions that come up in the chat. Also, making sure you're paying attention. Take active notes. When we take notes, we remember things better, even if we don't go back to read it. So take notes on anything that may be something new, something you weren't aware of, or something that we reminded you that you should be aware of and doing. And of course, yes, please, by all means, ask questions at the end. All right. So let's get started again. So understanding type 2 diabetes. So we're going to start with the basics. What exactly is diabetes? Type 2 diabetes is a chronic condition that affects the way your body metabolizes sugar, or as we call it, glucose, which is a crucial source of fuel for your body. So this is how we get energy. Unlike type 1 diabetes, so type 1 diabetes, where the body produces little to no insulin, type 2 diabetes does produce insulin. At the beginning, you have normal production of insulin. Then that ramps up because you have a high amount of what we call insulin resistance. And that means that that sugar cannot go into the different cells to be used for energy and stays in your bloodstream and accumulates and go quite high. That's what we call insulin resistant. Insulin is a hormone that regulates the movement of sugar into your cells. That's the simplest way to put it, but insulin has a lot more roles in your body. So we move sugar into the cells in order to utilize it as energy. So as you can see, if you can't drive that sugar into your cells to be used as energy, then it accumulates in your bloodstream and you get really high blood sugars. And then your body turns around, and as it sees all these high blood sugar, then it starts storing it as fat. So it is essential to understand that type 2 diabetes is often associated with lifestyle factors, including a not so healthy diet, no physical exercise. And this means, unlike type 1 diabetes, type 2 diabetes can often be managed, can even be prevented through healthy lifestyle changes. And as I like to say, you can even put it into remission. I don't say reversal because unfortunately, by the time people get that diagnosis of diabetes, you've been having high blood sugars for over 10 years on average. Many studies have shown. So what that means is, as you're having those high sugars and high amounts of insulin, you are damaging different tissues in your body, and some of that damage cannot be repaired. The biggest complication to diabetes is cardiovascular disease, heart disease, and unfortunately, that's one that it's not reversible. Okay, so common myths about about type 2 diabetes, myths that a lot of people talk about and spread is that you're getting type 2 diabetes because you're eating too much sugar. So while a high sugar diet can contribute to obesity, which is the risk factor for type 2 diabetes, eating sugar alone does not directly cause diabetes. It can certainly contribute to it. The real issue is the overall balance of your diet and lifestyle. So again, the causes of type 2 diabetes tend to be nutritional deficiencies because of the way you eat, food sensitivities and allergies. And we'll talk a little bit about how when you eat certain grains or starchy carbohydrates, your body acts like you're having an allergic reaction. Chronic inflammation, and this can come from several different places: stress, lack of sleep, going through menopause, hormonal changes, and increase insulin resistance that also comes from the types of food that you eat, but also from gaining weight, especially in the mid-session. If you have gut dysbiosis or your gut microbiome is not healthy, then you are not a healthy person. And then a lot of the toxins that we have around in our environment. All right, myth 2, that only overweight people get type 2 diabetes. Again, the majority of people who have type 2 diabetes do tend to be overweight or obese. While this is a significant risk factor to get type 2 diabetes, people of any weight can develop type 2 diabetes. It has a lot more to do with your age and your ethnicity, as well as some genetics. And of course, the biggest contribution is your lifestyle. So we have what we call skinny fat people, and these are people whose percentage of fat is quite high, even though in appearance they look thin. These tend to be people from Asian descent or Alaskan natives, and they tend to have a lot of percentage of fat in their body compared to muscle, lean muscle. And this puts them at high risk for insulin resistance, which again is a risk factor for getting type 2 diabetes. Myth 3, if you have diabetes, you must follow a specific diabetes diet. While there's no single diabetes diet, the best diet for managing your diabetes is a healthy diet that is balanced, nutritionally dense, and one that can help you maintain your healthy weight. So one that will induce some weight loss if you're retaining weight, and one that will give you all the nutrition that your body needs in order to repair itself and work the way it's supposed to. This typically means that we are going to focus on foods like vegetables and fruits, some whole grains, lean proteins, and healthy fats. Okay. Myth number 4, people with diabetes can't eat carbs. Well, that is completely untrue. Most of the things that we tell you to eat, like vegetables and fruits, contain carbohydrates. So carbohydrates are not your enemy. Grains may be something that you want to make sure you're not eating a lot of. And if you're having high blood sugar, something to omit. But overall, the amount of carbohydrates that we tell you to eat is quite high because we're encouraging you to eat more vegetables and fruit, again, which contain a lot of carbohydrates. And we also encourage you to eat certain whole grains, which are high in fiber and have a lower glycemic index. So this is where the key is. Making sure you're eating those foods that are lower in the glycemic index and that will not cause rapid spikes to your blood sugar levels. Myth number 5 is type 2 diabetes is a mild disease compared to the other types of diabetes. This is a dangerous misconception. Type 2 diabetes is a serious condition that, if you don't manage it properly, can lead to severe complications, which include heart disease, like we said before, nerve damage, kidney disease, vision problems, and more. Now, let's go over the types of diabetes that we know of. So we talked about type 1 diabetes. That's where your body doesn't make any insulin. And these tend to be kids and young adults. Type 2 diabetes, which is what we're talking about here today. Type 1.5 or LADA, which is late adult onset of diabetes. And this is similar to type 1, in which people tend to not make enough insulin, but it has some components from type 2 diabetes as well. Then we have gestational diabetes, which is something that you get while you're pregnant, tends to resolve after you have the baby, but puts you at great risk for getting type 2 diabetes later on in life. Then we talked about prediabetes. During the week, we talked a lot about how you have an increased risk of complications, just like having that diagnosis of type 2 diabetes. It's just that your sugars are not going high enough to get that diagnosis yet. So this is the best time for you to start making changes and avoid that full diagnosis of type 2 diabetes. And then lastly, during the week, we also talked about Alzheimer's now being called type 3 diabetes. And that's because a lot of the same things that apply to type 2 and type 1 apply to Alzheimer's disease, in which you also have a lot of insulin resistance. You have a leaky brain, similar to leaky gut. You still have that leaky gut. You still have toxins, toxic load, and then you also have that chronic inflammation. All right, so understanding these facts about the basis of type 2 diabetes can help you be more informed about your decisions. We highly encourage you to track your blood sugars and so that you become aware of your health status, but also how the different foods affect you. While we can give you a generalized rule about which foods can affect you the most, each person is an individual and they will act differently toward different foods. I gave an example during the week where one of my patients would eat a banana and have almost no spike in their sugars, while another person would eat only half of a banana and they would have a huge spike in their sugars, above 80 points, and really could not eat bananas because they would drive their sugars really, really high. So I highly encourage people to check their sugars often and check around the different foods so you can understand better how the foods affect your blood sugars. But also, what you don't measure, you cannot improve. So if you don't know how high your sugars are going, if you don't know what is affecting your sugars, it will make it a lot harder for you to understand what's driving those high blood sugars and how to manage them better. One of the most empowering steps that you can take in managing your type 2 diabetes is to regularly monitor your blood sugar levels. Tracking your blood sugars can help you understand how different foods and activities and stress levels affect your sugars, because it's not just foods that affect your sugars. It can also provide valuable insight on your health, on how to take whatever health plan you're taking, whether from your physician or wherever your diabetes educator, and modifying it to apply better to you. So when to check blood sugars. So it's essential to follow your healthcare provider's recommendations on how often to check your blood sugar, but usually if your sugars are not super high, they tell you to check early in the morning before you eat, and then a second time during the day. And usually I would say an hour to 2 hours after your largest meal of the day. And then once you have that meal under better control, then you can move on to one of the other 2 meals and do the same. So how can you check your blood sugar? So there are blood sugar monitors that help you track your sugars. Most of them will need a finger prick. You can also use a continuous glucose monitor or a CGM, which you can apply somewhere in your body, usually in your upper arms or your abdomen. And that can give you your readings, and you apply it from anywhere from 10 to 14 days. And that gives you either a flash reading, meaning you have to scan to get the reading, or a continuous reading that you can either get through a small monitor or your smartphone. So again, the aim of checking your blood sugars is to make sure that they start coming down, and once they're down, that they're staying in range. Okay, so by becoming more aware of your blood sugar patterns, you can take proactive steps to maintain your blood sugar under better control. Remember, knowledge is power only if you apply it. And tracking your blood sugar is a powerful tool in making sure that you're managing your diabetes well. Okay, nutrition and meal planning. So this is the second day. We talked a lot about what a healthy, nutritious meal planning means. So let's talk about the crucial role of a balanced diet in managing your diabetes. We talked a lot about the rainbow diet. And the rainbow diet basically is making sure that you're eating foods from every single color of the rainbow. And when I talk about the rainbow color diet, I'm referring mainly to real foods like vegetables, grains, and fruit and grains, and whole grains. So the rainbow diets, you have brown foods, you have white foods, you have yellow, reds, oranges, and purple. So and green. Green is the most important. We talked about green being good for cardiovascular health. The primary goal of managing a proper nutritional diet, or what I like to say is a healthy way of eating, because a diet is something that is temporary. This is a way of eating, a way of living, is to maintain your blood sugar levels within a healthy range, and giving your body all the nutritional things that it needs in order to improve your overall health, right? We talked about weight, about if you're overweight or obese, losing anywhere from 5 to 7% of your current weight will help you decrease your insulin resistance and make you more insulin sensitivity, meaning you can more easily now drive that sugar into the cells to be used for energy, and your blood sugar levels in the blood should start coming down. So for us at RX Health and Wellness, we follow functional medicine principles, and we strongly believe that by eating the right foods, you help release that extra weight from your body more easily, in a very healthy way. We don't count calories, but we do focus on the quality of the foods that you are eating. So the quality is more important than the quantity in the types of food. So we stay away from anything that is processed foods, foods that have tons of chemicals. Any food that you cannot read the label because there are all these chemicals in it is not a real food, in my opinion, and you should stay away from. So we want to eat more from farm to table, more of the real foods, and the foods that are going to give you more of the nutrition that you need. But you also need to look at the source of your food. You want to eat clean food. We don't want food that has tons of even vegetables and fruit, tons of chemicals that were spread, to get rid of insects, pesticides. We want to have organic foods that are better for us because they're not increasing our toxic load. We talked about heart health and how the biggest complication to diabetes is heart disease. We also talked about how we want to start getting healthy before we go through perimenopause and menopause, because that also on itself increases your risk for cardiovascular disease. So we want to make sure we improve our health before we start going through menopause in order to decrease our risk factors for cardiovascular disease. We talked about the green leafy vegetables being the best thing that you can eat for heart health. So ensuring a variety of different food and food groups is essential in your overall health in order to get the vitamins, minerals, antioxidants, and phytonutrients that you need in order to repair and improve your health. A balanced diet can boost your immune system and just the overall sense of well-being. Okay, let's talk a little bit about the glycemic index. The glycemic index is a measure of how quickly foods can that contain carbohydrates sorry, raise your blood sugar levels after you consume them. Foods are ranked on a scale from 0 to 100, with higher values given to those foods that cause very rapid increase in your blood sugar levels. So at 100, you have things like white rice and white bread. So low glycemic index foods, these foods tend to have a glycemic index of 55 or less. They are digested and absorbed more slowly. They tend to have a lot of fiber, leading to a gradual rise in blood sugars, and also helps to decrease the amount of insulin your body has to make. Some examples would be fruits and vegetables, whole grains, legumes, and nuts. But again, you need to look at each individual food to see where it falls. You have fruits that are higher in glycemic index and some that are lower. So all berries tend to be on the lower glycemic index. On the higher ones, you see things like mangoes and bananas. So something to really be aware of. So low glycemic index foods can help you maintain a more stable blood sugar level, which is crucial in managing your diabetes. It also helps you feel fuller because, again, tends to have more fiber. And it can also aid in maintaining your weight. So one of the things you want to make sure is that you don't keep increasing your current weight. All right, so creating a weekly meal plan is a powerful tool for managing your diabetes, ensuring that you're eating healthier foods, making sure that you're probably eating 80% of the time to 90% of the time a more healthier, balanced meal. Nobody can be perfect, and perfection is eluding, so it's not something that we strive for, but we do want to improve from where we are, right? So we want to make sure to start planning your weekly meals. You can include breakfast, lunch, or dinner, or you can just start with one of them. Make sure you're including a variety of foods, making sure you're focusing on including rainbow color types of food into your meals, choosing things that have more fat and fiber, like berries with sprinkled nuts or a vegetable omelet. Lean meats like chicken and turkey over red meat, which tends to be very high, tends to contain a lot of hormones, antibiotics, and it may not be the best source. You can get wild game meats or grass-fed beef, that would be better. Dinner, you can focus on, again, lean meals and vegetables. So baked salmon, again, the quality of your food, wild salmon, not farm raised. We want to be aware of the amount of mercury. So making sure, we talked about snacks, about how as we grow older, we really don't need as much food as we need in our 20s. And if you're eating snacks, you might start sort of getting rid of some of those snacks and looking forward to smaller meals throughout the day. We also talked a little bit about fasting more and more like the time constructive eating. So that's where you're eating for a certain amount of time and then not eating for a certain amount of time. We talked about 12-12, so 12-hour window where you're eating your 3 meals, and 12 hours where you are not eating, and that includes the time that you're sleeping. You can increase the amount of restrictive eating. You just have to be careful, especially women who are still menstruating and having their periods. And if you are over 40 and close to starting or have already started perimenopause, it can really influence even more those hormonal fluctuations. So I would stick to 12-12. At the most, I would push it to 10-14. So 10 hours of eating and 14 hours of no eating. But I would not push it more than that. We talked about making sure you're creating your meals and making a shopping list and sticking only to that list when you go grocery shopping. Making sure to clean your pantry from all those other foods that are not good for you. You can donate them. You can do a lot of things, give them to family members. Don't throw them out on food. It's hard, there's so many people who could use it. So plan ahead, consider how you eat, when you eat, what you like to eat. Be flexible. Start by making a list of recipes that you eat more often and you make at your house, and start by remaking each one by one, slowly, and making it to be more healthy. If you're not sure how to do that, maybe look up in the internet healthier versions of that meal. We also talked about being flexible, making sure you have things that you can snack on or eat at home, so that on the days that you don't have enough time to come home to prepare, you'll have things to eat more readily. We also talked about eating out and looking at the menu ahead of time on the internet, or choosing things that are going to fill you up more, like soups, so a lot more watery, staying away more from the creams type soups, more of the salads and the vegetables on your sides, maybe eating only half of your meal and taking the other half home, since the portion sizes tend to be so high. Concentrating on vegetables and fruits, staying away from sauces, from salad dressing, so you can put them on the side and just dip your fork, and sharing your dessert maybe with someone else, so you're not eating the whole dessert. All right. And don't forget your lean proteins. Oh, we also talked about, before I go on, before I forget, we also talked about the order in which you eat your meal has a big impact on your blood sugar. So we talked about how if you eat your vegetables first, then you eat your lean protein, then you eat your fats, your healthy fats, and the last thing you eat would be your whole grain or your grain, if you have any, in your meal. That will more than likely prevent high spikes after the meal. Again, it has to do with the amount of food, but also in the order in which you eat your foods. All right. We talked on the third day, we talked about physical activity and exercise. We talked about the benefits from the exercise. It will help you improve your blood sugars. So physical exercise, both your aerobic exercises, which is the one that's going to give you your biggest impact on your blood sugar, but also strength training exercises, flexibility and balance. So you should have all of these included in your physical activity. We talked a little bit about strength training because after 40, we tend to lose muscle and replace it with fat, which again can increase your insulin resistance. So we want to maintain the muscle that we have. And as you lose weight, you want to increase your muscle mass. We talked about how exercise doesn't really lead to weight loss. It can help you maintain your weight. It can help you if you combine it with your nutrition to help you lose some weight, but by itself is not the way to lose weight. It won't lead to weight loss, but it can help you again maintain your healthy weight. And the biggest impact with exercise is that it can increase that insulin sensitivity. So it will improve your overall blood sugars. We also talk about how your heart is a muscle, and regular exercise strengthens your heart and improves your circulation, reducing the risk for heart disease. So it can also help you control your blood pressure and your cholesterol, which often are high for patients with type 2 diabetes. It can also enhance your mood. Patients with chronic diseases tend to have a higher risk for things like anxiety and depression. So physical activity releases endorphins. These are your natural body's mood lifters, which help you feel better and decrease those symptoms of depression, and can also boost your energy overall. We talked about better sleep and how sleep is one of the biggest things that you can do for your health as well. Exercise can help you regulate your sleep pattern, making it easier to fall asleep and stay asleep. So if you have a hard time falling asleep, you don't want to exercise close to bedtime. You want to do it in the morning as you wake up. Expose yourself to sunlight. Make sure you have an evening routine, staying away from electronics 1 to 2 hours before going to bed. So improving your overall quality and quantity of sleep is really important to your health. We talked about, again, aerobic exercises such as walking, cycling, swimming, and dancing. And you want to aim for 30 minutes for 5 days out of the 7 days per week. And then 2 days of strength training, such as weightlifting or body weight exercises for 30 minutes each day for 2 days. You also want to incorporate exercises for flexibility and balance, again, like yoga and Tai Chi. And yoga on itself can not only improve your flexibility and balance, but it can help you reduce your stress and improve your overall sense of well-being. So we talked a lot about how to start exercising, setting realistic goals. So if your goal is to end up doing 150 minutes of moderate type exercise, you want to start slow and low and slowly ramp up. Try to choose exercises that you enjoy. Some people like things like dancing or Zoom or what do you call it? Those dancing type classes. And stick to whatever you enjoy. Incorporate activity into your daily routine, making sure you take the stairs, parking away further, putting steps into your day. If you take public transportation, getting off one stop before and walking the rest of the way. Stay consistent. Consistency is key. Aim to make some exercise regular, and then the rest incorporate more movement into your day until you get to that 150 minutes per week. And then and plus the 2 days of weights. But you should still maintain a higher activity level throughout the day. Listen to your body, pay attention to what your body is telling you. People feel great after exercising. Some people have a harder time just starting the exercise. But pay attention to the level of pain or discomfort. Do not push yourself too much. If you do that, that's going to discourage you from continuing to exercise. If you have a lot of aches and pains, or you have cardiovascular disease, consult your doctor. Make sure it's okay to exercise, and have them give you a recommendation for the types of exercises that will be safe for you. Again, track your progress. If you're not measuring, you're not improving whatever it is. Okay? Start slow and ramp up. That's the biggest take from that. Okay, we talked about stress and how stress can actually make your blood sugars go up because you release more of the stress hormones like cortisol and adrenaline. We talked about how chronic stress really can keep your blood sugars elevated, and managing your stress is a big step in controlling your sugars. Stress can influence your behavior and lifestyle choices. When you're stressed, you tend to overeat or make not so good choices for your food and skip exercises, and also can impact, of course, your sleep cycle. Prolonged stress can increase your insulin resistance and increase the amount of insulin your body is making in response to the increased insulin resistance that can lead to all sorts of complications. Stress management, we talked about mindfulness practice. So being present and paying attention to the moment without judgment, but also being present for when you're making decisions about what you eat, your exercise, your sleep, and really trying to make better choices for yourself. Talked about meditation in starting slow with 5 to 10 minutes. We also talked about deep breathing exercises, trying the 4-7-8 technique. Inhale for 4, hold for 7 seconds, and exhale slowly for 8 seconds. We also talked a little bit about progressive muscle relaxation. And we also talked about how physical activity can also help you decrease your stress. Daily practice. So pick one and try to start with a couple minutes. You can start deep breathing exercises for a minute and then slowly ramp up. We talked about small steps on any of these and just slowly making changes. And once those become routine and you practice them every day, then you can add other smaller steps, and slowly those smaller steps become one large change. Creating routines and make them habits is the best way to do them. We also touched a little bit about mindset. We didn't go into a lot in that, and probably not a lot here, but we do go into that in the course. Be patient and consistent, because we're making smaller step changes. It can take a little bit of time to see the bigger rewards, but they will come. Okay, so sleep again. We just talked a little bit about that, but if you don't have a good night's sleep, your blood sugars will tend to be higher the next day. And if you are not having a good night's sleep several nights in a row, you can continue to have higher blood sugars for several days, and it can make it a lot harder to manage them and bring them down. We talked about how sleep affects several hormones in your body, because you're not giving your body what it needs, the ability to repair. So it can influence not only the hormones for stress, but also the hormones that regulate your hunger. So you tend to have a lot more hunger the following day, and you tend to crave more rich foods. You have an increased production of ghrelin and a decreased production of leptin. Sorry, you okay? That's my dog. He's been sick. Every time the air conditioning kicks, he starts coughing. And this imbalance will lead to overeating and weight gain. So both of which can have a big impact on your diabetes. Sleep is vital for your immune system. So when you don't sleep, your immune response is decreased, makes you more susceptible to infections, which you are already at an increased risk as someone who has type 2 diabetes. Sleep impacts your mood, your cognitive function, and your overall mental health. So poor sleep can lead to stress and anxiety and depression, which again can exacerbate your diabetes management. It can lead to cardiovascular disease. Sleep supports heart health and maintain your healthy blood pressure and reduce inflammation. So if you're not sleeping, you tend to have higher blood pressure and higher cholesterol, all of which will lead to higher cardiovascular disease. So maintain a consistent schedule. Go to bed and wake up at the same time every day, even on the weekends. Create a relaxing bedtime routine. Make sure you turn off. You okay? Oh, baby. Turn off your electronics 1 to 2 hours before bedtime, preferably 2 hours after. Oh, poor baby. Limit exposure to screen. You want to get more exposure to sunlight in the morning as you wake up to help your circadian rhythm in the production of melatonin in the evening. So turn off those screen. Make your sleep environment comfortable, cooler, quiet, less light. Mindful of not eating or drinking large amounts of food an hour to 2 hours before you go to bed. Also decreasing the amount of caffeine after 4 p.m. and no alcohol. Alcohol will disrupt your sleep patterns, no matter what time of day you drink. Get regular exercise, especially in the morning. That will promote a better night's sleep. Manage your stress. We talked a lot about stress. And limit napping during the day because that will interfere with your night's sleep. So consistency is very vital when it comes to your sleeping routine. Again, make sure you create all of these routines, and if you're not getting any improvement, then speak to your physician. Sorry, I'm going a lot fast because I have so much, and we're almost already at the 1 hour. So medication management, I just wanted to stop here. We did not talk about this week, but I just wanted to mention that I am a pharmacist by profession, so I am not completely against medication, but I did mention briefly that a lot of the medications that we have are geared to control that blood sugar, but do not address the root causes of your diabetes. So they are not going to take away your diabetes, and they only briefly slow down the progression of diabetes. The biggest things that you can do for your diabetes is the lifestyle changes, starting with the nutrition, starting with what you're eating every day. Some of the medications that are given to you can also decrease complications until you can bring your blood sugars down to more good levels. A lot of times you're giving medications to reduce hospitalizations and to maximize whatever you're doing in your lifestyles until you're under better control. But overall, medications are not going to reverse type 2 diabetes. So adherence is important in any medications, whether medications or supplements, but again, these are not gonna reverse your diabetes. More often people are put on metformin. That's the first medication that is prescribed. We also have older medications called sulfonylureas. That's where you will have your glipizide and glyburide. They're very effective, but they don't protect your heart. And metformin is good for the sugar that is going up overnight, but not so much for the blood sugar after the meals. You have your DPP-4 inhibitors like sitagliptin and saxagliptin. And these help reduce blood sugar levels. And you also have your GLP-1s, which everybody's very familiar with lately. These are the ones that are not only used for diabetes, but for weight loss, and such as exenatide and liraglutide. So these medications help you feel fuller, and then it help you lose weight. Again, the weight that it helps you lose is weight that comes off not just from fat, but also from some of muscle and other tissues. So you have to be careful. You have SGLT2s, and these are given for patients who have diabetes and congestive heart failure. kind of in kidney disease, canagliflozin to prevent kidney disease, dapagliflozin. So there's insulin, and then there's diazolidinediones. So all of these medications work differently, and they could be considered by your provider. Again, these are medications that will help you bring down your sugars, so that you can reduce your risk for complications, but they're not gonna resolve the diabetes. So it's important to work on lifestyle. So that's why lifestyle is so important, especially what you eat. Let's see, make sure to talk to your doctor. A lot of these medications have a lot of side effects. We also encourage some supplements like berberine but again, all of these, and we talked about a lot about these during the blood sugar solution course. But again, these are going to help you bring down the sugars. They may help you improve your metabolism, but it's the lifestyle that's going to have the biggest impact in reversing or putting into remission your diabetes. Okay, let's talk a little bit about toxins, which I did not talk about during the week. I hinted about, but let's talk about the connection between toxins and diabetes. First, we have your endocrine disruptors. Certain toxins known as endocrine disruptors can interfere with your body's hormone system, including those involved in insulin production and regulation. These disruptors can lead to insulin resistance, which again is a key factor in type 2 diabetes. Toxins can also cause chronic inflammation in your body. This inflammation can damage cells and tissues, contributing to insulin resistance and impairing the ability of your body's management of sugars. It can lead to oxidative stress, and it's similar to what it sounds, oxidative stress. Oxidating meaning turning metallic to brown and corrupting the metal. Kind of the same thing happens in your body. Exposure to these toxins can increase your oxidative stress, which occurs when there's an imbalance between the free radicals. These are bad things that are like leftovers as your body's chemical reactions to produce different hormones, even energy are left. And your body's antioxidants, which is what sort of involves those free radicals and helps your body get rid of them. And these free radicals can damage your cells and lead to all kinds of health issues. Some toxins can directly affect your pancreas, so your pancreatic function. This is the organ that makes insulin production. There are cells in your pancreas called beta cells that produce insulin. So if you're having less insulin production, that can lead to higher blood sugars. So there's a whole list of toxins out there. So pesticides commonly found in non-organic fruits and vegetables. Pesticides can disrupt your endocrine function and contribute to insulin resistance. Things like Roundup. Bisphenol A or BPA is a chemical that is used in the production of plastics. BPA can mimic estrogen and disrupt hormonal balance. You can find them in plastic water bottles, and they do leach out of these into your water or whatever you're drinking. So we encourage you to drink out of glass. Phthalates, these are chemicals that are used to make plastics more flexible and can interfere with hormone function. So again, you can find them in some personal care products like shampoos and lotions and house cleaning products. Heavy metal exposures like lead, mercury, and cadmium, they can cause a lot of oxidative stress and inflammation. They can be found some in water, some in fish, like mercury, some in oil paint, and in the industrial pollutants. Polychlorinated biphenyls, or PCBs, are the industrial chemicals that have been banned but still persist in our environment, and they can disrupt our endocrine function. So you can still find them in our food source like fish, meat, and dairy products, and all electrical equipment. Air pollutants, particulate matter, and other pollutants that can contribute to inflammation and oxidative stress, such as vehicle emissions, industrial emissions, tobacco smoke, and indoor pollution. Perfluorinated compounds such as PFCs are used in non-stick cookware and stain-resistant fabrics. These chemicals can interfere with your hormonal functions. They can be found in non-stick cookware, water-resistant clothes, and some food packaging. A lot of these chemicals can also are also called obesogenics because they can contribute to weight gain. So start looking around your house for potential sources of toxins, things in your diet and your environment, and consider starting to remove some of these products and just be more aware that they are all around that. Your body has the ability to detoxify itself. Your liver is the main detoxifying organ, but it can get overload. So the load, your toxic load, can lead to, again, a lot of health problems if your body is not able to detoxify in a good way. So we need to support your liver and your detoxification. The main ways you detoxify is through feces, urine, and your breath. So you need to make sure you're breathing consistently well and deep. You're producing enough urine, so drinking enough, being enough hydrated, and then moving your bowels. Okay, so tips for reducing your exposure. Choose organic produce. I know they are a little bit more expensive. You can also prioritize buying organic from the Dirty Dozen list and buying the regulars from the Safe 15. Use BPA-free containers or replace plastic again with glass. Filter your water. Buy an inexpensive filter that can filter most contaminants like heavy metals, chlorine, and other pollutants. Opt for natural cleaning products. Be careful with your personal care products. Read all the labels. Make sure they don't contain phthalates, parabens, or synthetic fragrances. Avoid non-stick cookware. Alternatives such as stainless steel are good alternatives, cast iron or ceramic. Reduce processed foods again. These can tend to contain a lot of artificial additives, preservatives and chemicals, eating more whole types of food, unprocessed foods, from farm to table. Improve your air quality. Use of air purifiers or house plants is a good way to go. Reduce, sprays or things that make your house smell better. Maybe use some essential oils in diffusers. Use soy candles instead of regular candles. Limit canned foods. Canned foods contain BPA. So opt for fresh foods or frozen foods, and look for brands that often will say they're BPA free in their cans. Again, small steps, big impact. Start with 1 or 2 changes that are easier for you to implement. As you become more comfortable, you can gradually incorporate more changes into your routine. Build those sustainable small habits. And as you increase those small steps, they will become one large step. Focus on what you can control. Don't get stressed over, reducing the toxins in your environment. Just do what you can. Substitute cleaning products, for example, that could be a good way to start. Start choosing more organic foods. Again, look at the Dirty Dozen list and the Clean 15. Switch to glass containers slowly. That's what we did in our house. Use more natural personal products. Filter your water. And use plants or purifiers to help clean your environment. Okay. All right, so if it's okay with you now, I'd like to talk a little bit about our course that will be starting on the 15th. The doors are open until tonight at 11:59, the blood sugar solution course. So if it's okay with you, you can start putting your questions on the chat, and I will address them after this brief introduction. So the blood sugar solution is an 8-week course that combines live weekly session with pre-recorded content. Each week you'll learn about a specific aspect of the blood sugar management and receive practical tips and strategies that you can implement in your daily life. So week 1, we'll talk about understanding blood sugar and diabetes. Week 2, we'll talk about nutrition and meal plans. We'll create a meal plan that supports your blood sugar levels. Week 3, exercise and physical activity. We'll talk about the different exercises and how to create an effective workout routine, one that's going to fit into schedule. Week 4, we concentrate on stress management. We go into the different things like mindfulness, meditation, and we'll give you ways of practicing and actually doing them. Gut health on week 5. We talk a lot about probiotics, prebiotics, and gut-friendly foods. We will tell you which probiotics we recommend and where to get them. Week 6, we'll cover everything about medication management. We'll talk about the different medications, including medications that come along other than the diabetes medications, such as blood pressure medications and cholesterol medications. On week 7, we dive all into toxins and diabetes and how to clean your environment and the practical ways to reduce your toxin exposure. And then on week 8, we put everything together in a more cohesive, sustainable plan for you. Each week includes a live 1-hour section again. We will give you also, depending on what the needs are for the students, we can do an extra hour to 4 hours of question and answer where we can address any questions, concerns, things that you're not clear on. Again, this is a very comprehensive education. We do give you practical stress and strategies to help get you started, but the main focus is in education. We'll give you resources and tools that you can use. You will be part of our community and meet others like you that are trying to do the same thing, connect with others that will help each other. We talked about the long-term benefits of knowledge, but we also talk a lot about knowledge is just one component of power. The second one is action. Between the live presentations, which will be recorded, and the pre-recorded content, you have the flexibility to work on it on your own. So register today because it's the last day. Transform your health. Imagine your future where you have more energy, better control over your blood sugars, and you're reducing your risk of complications. It's a very easy way to register, and we're giving you 2 bonuses. One is, of course, our Empower Wellness course for women over 40. And the second one is we're offering you a 3-month free membership, part of being of our membership, to help you implement everything that you learn in the course. So after your 8 weeks, you'll have 3 months free access to our membership that will help you then implement a lot of the things that you learned during the course. So those are the 2 big bonuses. We are also giving you a coupon for 30% off. If you apply this coupon as you're registering, you get 30% off the price, which is $480. So that will bring you to about $340. This is the place where you can register for the course. And thank you so much for letting me talk to you a little bit about the course. I want to reinforce the importance of taking action. Knowledge, again, is a powerful tool, but only if you take action with it. By applying what you've learned today and enjoying the Blood Sugar Solution course, you're making a proactive choice to, if you join the course, to prioritize your health and your well-being. Take actions not only to help you manage your diabetes more effectively, especially before you start going through menopause, but also empowers you to live a fuller, more healthier life. Remember, small steps can lead to significant improvement in your health. This course is designed to provide you with the support and resources and a community to make those changes easier on yourself. So I look forward to seeing you in our blood sugar solution course and supporting you in your health journey, your health transformation. And thank you so much. So now I will open it up to questions. But here are the 3 resources I promise you. One is on meal planning. One is on what I can eat with type 2 diabetes. And the other one is a good night's sleep. So you can just click and you'll be able to download all 3 resources. All right, so questions. All right. See, the question is, do you think the newer medications are a good choice? So again, I am not against medications. They do have a lot of side effects, and these are not for everybody. Not everybody gets the side effects. Some people benefit greatly from the weight loss and from the blood sugar improvements. It is something that is very particular to you, so it's hard for me to comment on it since I don't really know the details of your situation, but it's something that you can discuss with your doctor. I can tell you that for the weight loss part and even for the blood sugar improvements, if you come off the medication, that all goes away. So what they're now saying is that you need to stay on these medications long term. And I don't know about you, for me, that's not something that I would have chosen to do or liked. I read that metformin is really bad for you and that it shouldn't be taken. Well, metformin, like any medication, like I said, have really bad side effects like diarrhea, abdominal cramping, and overall, it can't, can reduce your quality of life if you're taking and having all these side effects. Overall, all the long-term studies of metformin and how it affects diabetes have been positive. It improves your diabetes a lot. And it has been linked to long-term benefits, so long-term beneficial outcomes, better health outcomes, longevity type things. There are very few bad things about it. Main ones are the side effects. Again, long-term taking of medication might be something you're concerned with. Let's see. So why only 5% of weight loss? Don't you need to lose all the weight? So yes, it would be great if you can lose all the weight. Weight loss is something that is really hard and really hard after 40. But studies have shown that as little as 5 to 7% of your current weight, if you lose that amount of weight, it can help you improve your blood sugar solutions. We certainly would encourage you to continue to lose weight until you reach an ideal weight for you. Every person is different depending on your body composition, your muscle mass versus your fat composition. But again, we encourage you to do that in a healthy way by having a healthy eating and nutritious eating plan versus a short-term diet. Let's see.
will you offer the course again in the future? I can't currently enroll. Yes, we will be offering the course again. So July, August, probably in September. We will also be opening our membership again in September for those who want to enroll. Okay, it looks like that was all the questions. If you have any further questions, you can put them in a DM in Facebook or Instagram. You can also tag me into a post on Facebook, or you can send me an email to support@rxhealthandwellness.com. Thank you so much for coming, and those of you who registered, even if you were not present during the presentation, will get a copy of the recordings. Thank you so much. Have a great rest of the day. Bye-bye.